The U.S. government to suspend foreign aid has left many nations in limbo. Global health experts now warn of a possible surge in preventable diseases as well as deaths. Countries have been urged to be self-sufficient, as Elizabeth Atieno now reports.
Kenya has been listed among 8 countries in the world running out of ARVs following the U.S. government's decision to pause foreign aid.
8 countries now have substantial disruptions to antiretroviral therapy and will run out of medicines in the coming months.
Including Haiti, Kenya, Lesotho, South Sudan, Burkina Faso, Mali, Nigeria, and Ukraine.
This means that the lives of the over 1.3 million people living with HIV who rely on ARVs is at risk, posing a serious concern over a possible surge in HIV infections as well as HIV-related deaths.
Disruptions to HIV programs could undo 20 years of progress, leading to more than 10 million additional cases of HIV and 3 million HIV-related deaths, more than triple the number of deaths last year.
We already have reduced our ambition for that budget down to 872 million. We know that we're not going to go, so we've reduced our budget targets, and within that we've done 60 million of cost containment measures.
As the impacts of the US funding cuts persist, countries have been urged to invest their domestic resources on health to fill up the financial gap. The Ministry of Health saying it is coming up with measures to cushion Kenyans from the ongoing crisis.
So as we continue looking into this, the government is equally looking into the internal resource mobilization.
I think there's no doubt we have relied here in Africa on donor resources for a very long period of time. And this crisis, and it is a crisis in international development right now, is also an opportunity for us to really take our space and to really start making decisions that benefit our population.
Millions of people are now at risk of contracting HIV, polio, measles, TB, and malaria, not forgetting that over the last 2 decades, the U.S. support for malaria helped prevent over 2 billion cases and 12.7 million malaria-related deaths.
We could see an additional 15 million cases of malaria and 107,000 deaths this year alone.
The U.S. has been urged to reconsider its move on foreign aid and cut the funding in a gradual and humane manner to allow for the affected countries to find solutions, as global health experts cite dialogue as the most effective way for U.S. to resolve the crisis that poses a risk to global health. Elizabeth Atieno, TV 47, Nairobi.